Good morning, good afternoon, and good evening, everyone, depending on where you are joining us from. My name is Dr. Anthony Eshofane, and I'm the team leader for the Health Security and Emergency Response at the WHO Bangladesh Country Office. I welcome you all to this fifth and the final day of the third Global School on Refugee and Migrant Health, which is being broadcast live from Dhaka in Bangladesh. Today, the focus of our school will be on capacity building for refugee and migrant health through global and regional cooperation and synergy. As we get started, I just want to remind you of three quick points. One is that we welcome your questions and comments on the chat box, and we'll respond to them as much as we can. The second one is that towards the end of the section, there will be a QR code which will be provided. So if you scan this, it will take you to a series of surveys for today and for the entire 5-day program. We do really value your feedback and how to improve this. Also, the link will be provided in the chat box. And for those of you who are formally registered, it will also be sent to you by email. Secondly, or thirdly, at this point, that all the recordings, all the presentations, and video reportages for this entire event will be on the event website for your further access and education. So thank you very much. At this point, I would like to introduce a colleague of mine, Dr. Pino Annunziata, who is with the WHO Program on Health and Migration in HQ as Senior Advisor to walk us through what we expect for the day. Dr. Pino.
Thank you. Thank you, Dr. Anthony. We are reaching the end of the school, and this day we will like to focus on the need for interregional, intercountry, and international collaboration to strengthen the capacity building and to promote new competencies to health staff dealing with refugees and migrant health. Migration is a pretty complex, global, international, and interregional and intercountry dynamic, which needs specific competencies of the health workers dealing with migrant and refugees' health. This is because this population imply specific health risks that need specific competence to address them. There is a notion, basically, of capacity building activities, training, formal training and non-formal training going on all over the world. The need is to try to coordinate, to make them compatible with the required standard competencies for addressing health needs and rights of refugees and migrants. Therefore, today we will focus with a panel discussion with experts from various international organizations, various international agencies dealing with migration, in order to understand from them what could be what are the best options for further improving the coordination on this specific aspect. But before to this panel discussion, we will have also a keynote speech this year, this day, provided by Gerald Rockershaw, which is the Regional Emergency Director for the European region, in which he will focus on the need to better link emergency and humanitarian intervention to development action. Just to remind you that this is the focus of the school is on refugees and migrant health. So dealing with massive wave of refugees that, of course, they need emergency intervention, but still, since those populations will, in many cases, remain in the hosting countries for a prolonged period of time, then it will be necessary also to have some structural adaptation of the national health system of the receiving countries to properly address needs and rights of these vulnerable people. Dr. Anthony, I will give you the floor again to you for introducing the rest of the day. Thank you.
Thank you very much, Dr. Pino. So without wasting much time, let's just go straight to the high-level keynote address for the day, which we provided by Dr. Gerard Rockenshop, who is the Regional Emergency Director for WHO Regional Office in Europe. Over to you, Dr. Rockenshop.
Greetings from Copenhagen, colleagues. My name is Gerald Rockenshop. I'm the Regional Emergency Director in WHO Europe, and I was asked by organizers of the capacity building for human resources for refugee and migrant health for the third summer school to provide a few reflections about the capacity building challenges, particularly at the humanitarian development interface of refugees and migrants. And I would like to start with drawing a bit from recent experiences in the European region. The Ukraine crisis obviously triggered massive displacements. More than 15 million have left Ukraine, fleeing the fighting. And we have more than 7.8 million refugees across Europe. 4.7 of those have registered for temporary protection, providing health services across Europe. But also 7.7 million have crossed back into Ukraine. So we see a very fluid situation where refugees become migrants and migrants become refugees, very much reflecting the situation that we also see globally. And capacity building to prepare health professionals to address the health needs, the specific health needs of migrants and refugees is certainly a challenge in humanitarian contexts, but also in the development field. And this requires very specific competencies of health professionals. There is a variety of training activities already available, but I think what we need is a more consistent and standardized approach compatible with global competence standards. And we need to synergize training and capacity building activities in humanitarian settings with those in more stable contexts. Acute emergencies these days tend to become more and more protracted crises, many of them then lasting for decades and longer. So I think what is needed by UN agencies, by international partners, by NGOs is to build a common educational platform and to promote also an educational nexus that can address both the needs in humanitarian and life-saving settings, but also in the development arena. We need this continuity in delivering quality health services for refugees and migrants, and we need to have a system strengthening and resilience building perspective in order to leave no one behind. Effectively addressing the health of migrants and refugees is certainly a litmus test for our health system crisis responsiveness and the broader right to health. We in WHO Europe look very much forward to work with you, with our partners, in order to move that agenda forward. Thanks very much, and I wish you successful deliberations during this very important course. Thanks.
On how to build greater capacity in emergencies and crises, and how to use those to prepare better and to make sure no one is left behind. And we do better each time we have to respond. Thank you very much, much appreciated. So at this point, we'll go on to the next agenda on the program, which is a panel discussions. And this panel discussion will be around the topic for the day. We have a set of experts who will be providing their thoughts. So there is a moderator, and I'll be introducing Dr. Baltica Cabiesis, who is from the Université de Desarrollo in Chile. She's also a board member of the Latin American Migration Hub for LACET. I would love to welcome her to the program and ask her to lead the panel discussion. Over to you, Dr. Cabiesis.
Thank you very much. Good morning, good afternoon, and greetings from Santiago de Chile in South America. It is my true honor to be moderating the panel discussion today at the end of this very exciting third global school on the health of refugees and migrants, dedicated to human capacity building. Our topic of discussion today is the need for international collaboration to protect the health needs and rights of migrants and refugees worldwide. International migration is, by definition, a complex inter-country dynamic calling for a global and regional interconnection, experience sharing, and trust to properly address the health needs and rights of refugees and migrants. Ensuring equity, inclusion, and continuity of care across countries requires the common definitions of competencies, guidelines, and tools, and the capacity to adapt them to specific contexts and needs. Within this framework, national governments, civil societies, and international organizations have a specific and a crucial role in building the competence of the health workforce and in addressing both the political complexity and the financial challenges related to the promotion of refugee and migrant health. This is a complex, diverse, and dynamic theme that requires a deep understanding of existing gaps and missed opportunities, of synergy between countries, and align mechanisms for unequal access and use of healthcare services by these groups across countries, as well as political and strategic relationships between governments, the capacity of response of regions, civil society, and international aids, among others. We hope that today's discussion will promote participants' reflection upon what is essential capacity building in terms of themes and competencies needs to be always assured in every country, the ongoing joint efforts to strengthen inter-country collaboration and coordination, and how global standards could be identified and adapted to specific contexts and needs. As a starting point for today's discussion, one key question to pose is, what are the lessons learned in relation to regional and global cooperation concerning the health of refugees and migrants, and what are the urgent challenges at this level of action? I will kindly invite Anne Burton to join us and share her thoughts around this question. She's a medical doctor with a Master of Public Health. She has over 20 years' experience in international health programming with governments, NGOs, and UNHCR. Most of this has been with conflict-affected and displaced populations in Asia, East Africa, and the Middle East. She has been with UNHCR for 17 years and is now the Chief of the Public Health Section in UNHCR Geneva. Dear Anne, welcome. The screen is yours.
Thank you very much, Bautika, and good morning, good afternoon, colleagues. I'm very, very happy to be with you today. I'm just going to briefly highlight some of the lessons learned about regional and global cooperation concerning the health of refugees. My focus will be on refugees. So firstly, global cooperation is critical to developing a shared understanding and agree on approaches and desired outcomes when it comes to health in relation to refugees. We have seen with the Global Compact on Refugees and its subsequent application at country level that the concept of burden sharing is very important. Most refugee hosting countries are willing to include refugees in national health policies, plans, and strategies, but they need additional resources to be able to sustainably do this. So this highlights the importance of easing pressure on host countries, one of the tenets of the Global Compact on Refugees, and this requires coordinated and coherent humanitarian and development interventions. In recent years, we've seen an important change in this regard, in particular with the World Bank's engagement in refugees situations, both with the IDA, host communities and refugee sub-windows for lower income countries and the Global Concessional Financing Facility for middle income countries. These have been instrumental in supporting the establishment of more inclusive refugee policies and the strengthening of institutions in 25 refugee hosting countries. These new funding windows also provide the much required additional and predictable funding to countries hosting refugees. Secondly, we very much appreciate the support shown by member states in the World Health Assembly resolution on promoting the health of refugees and migrants and the subsequent global action plan. The action plan recognises that while providing services through one health system for refugees and migrants is cost effective, that differentiated approaches may be needed. For example, refugees may have increased needs in relation to mental health and psychosocial support services or gender-based violence services. They may have different languages, different cultural backgrounds, and may require interpreters or cultural mediators. So therefore, a differentiated response through a well-supported national system will contribute to meeting the needs of both refugees and host communities, will build health system resilience, and will facilitate progress towards universal health coverage and promote peaceful coexistence with the host community. The last point I want to make before just giving two quick highlights of regional cooperation is the interconnectedness between improving access to health services and the recognition of other rights. Recent work by the World Bank and UNHCR found that cost is the greatest barrier to accessing health services by refugees and internally displaced in 4 country case studies. Yet, 82% of refugees globally have restricted access to formal employment, and they're not able to leave the humanitarian system and contribute either socially or economically. So promoting the right to safe and meaningful employment or access to land will greatly facilitate pathways towards self-reliance and to accessing essential social services, including health. Just want to highlight two regional examples of cooperation. One is UNHCR and IGAD, the Intergovernmental Authority on Development in East Africa, where both agencies have had a long-standing collaboration. In 2017, IGAD convened the Nairobi Summit and resulted in the Nairobi Action Plan, which called for a paradigm shift in addressing forced displacement and mixed migration from a humanitarian and security challenge to a development challenge. Just quickly, they have the response to this is actually focusing on four sectors, one of which is health. And this has resulted in a regional action plan in the health thematic area, which is still in draft, but should be finalized in 2022 or early 2023. Some of the areas of that action plan will be focusing on improving leadership and coordination, and in also multi-year funding, as well as addressing to contribute towards addressing financing gaps. Lessons learned on this have shown the importance of high-level political commitment, countries sharing promising practices and working together when they have shared challenges, and that there is often a need for law and policy changes to advance on commitments. And though we've actually run out of time, I will maybe highlight also another example that I won't go into detail, which is the 3RP, the Refugee and Resilience Plan in relation to Syrian refugees, which is now in its 12th year. And it's combining humanitarian and development funding streams for over 5.5 million Syrian refugees in 5 countries, Turkey, Lebanon, Jordan, Iraq, and Egypt, and also 4.8 million host community members. Now, health is one of the important components, and the 3RP has really led the way in terms of the international community support to national efforts, and of course the host governments are in the lead here to deal with the impact of the crisis. I will stop there as we've run out of time, but thank you very much. Thank you.
Thank you so much, Anne, for this interesting and quite complete response. Thank you very much. I would like to invite Santino Severoni to join us in this discussion. Santino is Director of the Global Health and Migration Program, Office of the Deputy Director General at WHO headquarters in Geneva. He's a medical doctor, health economist, epidemiologist, and experienced in health systems management. Dear Santino, what do you think about the same question? And what are the lessons learned by countries in relation to regional and global cooperation? And what are the urgent challenges at this level of action? What would you like to comment on or complement to Anne's intervention?
Thank you so much, Baltica. Indeed, I would like to share a few considerations looking at the inter-country and regional cooperation and global cooperation from the health angle. If we are connecting health and migration, certainly migration is one of the important triggers stimulating possibility for regional cooperation and inter-country cooperation, but it's not the main. Let's be honest, it's not the main reason why countries tend to establish those regional cooperation. Usually, the main reasons are related to economic or stability processes, but those very soon realize into a quite substantial benefit for the health sector and for sector like migration, because they are simplified movement of population, of people. If we look at the some examples from country perspectives, cooperation among countries or horizontal partnership tend to have a sort of boosting effect of existing health capacity by encouraging the sharing of knowledge and know-how between partners and countries. This situation, this series of factors, this context tend to, as such cooperation tend to strengthen and accelerate the health development at all levels and across the region. At the national level, cooperation among countries can also create an important momentum to contribute to changes, innovation, and as a consequence, having a tremendous impact on the national or supranational policy debate, so really informing the policy debate or inspiring the policy debate. All those reality tends also to be influenced and multiplied through inter-country exchange. The exchange of know-how, but also the physical twinning between countries is a tremendous instrument to increase the collaboration and have an impact at the sub-regional level, but also regional level, and boosting cooperation that may lead into collaboration process and also integration and freedom of or simplification of mechanism of exchange. We need to consider that behind the inter-country collaboration, or the principle behind regional cooperation, entails that there will be an harmonization of law, procedures, rules, and this is going to be extremely important for the health and for elements related to migration. All those processes are also extremely important to create space for dialogue and diplomacy among countries. This is particularly needed. We have seen during COVID. We see every day with issues related to the management of migration, and really help innovation to emerge, help important lesson learned and good practice to emerge from that. Health, it's really among those sectors which can benefit the most from inter-country or regional harmonization and integration by bringing countries and partners together around the same table of shared values and common problems approach. This is much needed when you need to face complex issue. Again, allow me to allude once more to the COVID pandemic response situation. I also like to underline that we are not talking about something new, something that we are discovering now. The concept of country cooperation, regional cooperation, it's actually quite a long-lasting idea, also characterized by fantastic experiences which are still functioning and still producing incredible results. Allow me to mention something which probably everybody knows. One of them is the European Union, the Arab Leagues, the Caribbean Community, the Eurasian Economic Union, the Shanghai Cooperation. Myself, and allow me to share a personal feeling, I devote a lot of interest to the work that the African Union and IGAD, they are developing now. Also because it's interesting, a continent which is, in one hand, if you are looking at the issue of migration, certainly bear a huge share of the management of migration, which is often not acknowledged by the dialogue and the narrative at the international level. From the health point of view, is a continent where still we are seeing a number of situations of fragility and need of support in terms of the health sector. So I'm extremely interested to see how this process, which is placing among the priority, migration and health, is going to be developed. I conclude by just listing, I was getting prepared for today, I was reflecting what are actually the impediment, the obstacles, the things which countries fear in this process, or which are the impediment really delaying the process for a regional integration and collaboration. Well, certainly the political leadership. If this becoming an hostile political landscape with nationalistic attitude, certainly this is a big impediment. But the political landscape can be also the making difference factor in this process. Resource. Countries, in engaging into this process, we must recognize need resources in order to invest into strengthening capacity, strengthening infrastructures. Imagine health. The inter-country collaboration need to be factively and pragmatically supported. Very often it's pretty spontaneous, it's pretty on voluntary basis, while we're supposed to have a mechanism, tools to facilitate exchange of good practices and experiences, really supporting twinning programs between countries, really supporting regular exchange of experience, because this is just the recipe leading into innovation, open mind approach, and bringing new reality and development. Documenting these experiences. A lot is going on and there is no documentation. So really investing into research and collecting the information and data is paramount, because from there we can draw a roadmap, an SOP, a standard operating procedure for other countries to repeat the same process without being forced to reinvent what already experienced by other countries. And then last but not least, certainly we need to monitor how far we go. also to introduce improvements or corrections if needed, or to revise the strategic approach. Thank you very much, Baltica.
Thank you, Santilio, and thank you both for this intervention that brings unique attention to relevant experience in international health programming with governments, civil society, and international agencies. Cooperation based on a shared vision and trust are essential aspects of human capacity building to promote the health needs and rights of migrants and refugees globally, and you both have highlighted that through your experience and knowledge. So thank you very much for that. Global change can also start locally with extraordinary efforts conducted at country level. I will now ask Philippe Grandet to kindly join us at this moment. Philippe is an expert on United Nations interagency work, joint programming, and joint funding mechanisms. He was actively involved in developing system-wide guidance and tools. In the wake of the adoption of the Global Compact on Migration in 2019, he oversaw the design of the Migration Multi-Partner Trust Fund, called FOR, by the member states. He subsequently joined the Secretariat of the United Nations Network on Migration. Dear Philippe, thanks so much for joining us today, and please go ahead. The Migration Multi-Partner Trust Fund, MPTF, is a funding instrument to support the implementation of the Global Compact on Migration. Could you please provide some details about these unique funding mechanisms? Are there any specific objectives privileged over others? Over to you.
Thank you very much, Baltica. Well, let me start very quickly by saying what the fund is. It is what we call a joint funding instrument, meaning donors, in our case mostly or most exclusively member states, contribute together, put all their money in one single basket. There is no tracking of which money belongs to whom. And that basket of money, that pool fund, is accessible and accessed by a variety of actors. It's not one agency implementing everything, and it's joint ownership and then joint action. It is the only such instrument in the field of migration. There is a number of such instruments that are existing, but in the field of migration, it's the only one. And it is the only one, and it's not an idea from IOM, from me, from whoever. It is a request from the member states to have established this fund. This was included as in the General Assembly resolution adopting the Global Compact on Migration. There was a call for this fund to exist. Now, this fund intends to embody the spirit of the Global Compact on Migration. The Global Compact on Migration was adopted after long and fruitful, even if sometimes difficult, discussions amongst all the member states, whether they were country of origin, country of destination, country of transit, together with stakeholders who were very much engaged in the process, and that led to the adoption of that compact. The fund intends to embody that spirit of partnership, and it embodies it in the way it's governed. It is not governed by one individual or one entity. It's governed jointly by a steering committee composed of representatives of the different constituencies. There are member states in their capacity of country of origin or transit or destination. There are donors, there are UN agencies, members of the UN network on migration, and there are stakeholders, civil society representation, human rights mechanisms, and so on. So, and this steering committee takes jointly all the decisions, and so far has taken all the decisions related to the fund by consensus. So it is in itself a cooperation tool for states and beyond the states, for all stakeholders to agree on priorities and agree on the way forward. It's also embodying that partnership in the way it works. The fund doesn't fund a single entity. It's WHO cannot come and say we have the brightest idea, and even if it is the brightest idea, on something to do around health issues of migrants, or UNICEF coming about an idea around children on the move, or any of this. The fund will not fund this. The fund funds joint initiatives. It's 2 or more UN agencies coming together with their national partners, both governmental and non-governmental, and seeking as a joint action, as a collective action, putting forward an idea where the comparative advantage of the different actors is really maximized. So that's the way it operates. And it's even, as I was saying, embodying that spirit in the way it is funded. It is funded by different donors, and one important aspect of this that it's not only funded by the usual suspects. Yes, a lot, most of its money comes from large, generous contributions from Germany, was the biggest donor, but also, I don't know, the US. I don't want to upset any member state by not naming it, but I would say the US, France, the UK, Norway, Denmark, all have made large contributions to the fund. But it's also funded by countries from the global south. We have contributions, maybe modest in size, but very important in the spirit and politically, from countries such as Mexico, the Philippines, Thailand, Bangladesh. Very recently, Kenya announced its contribution. So that's the way it operates. Now, what is the fund trying to do? It's trying to showcase and demonstrate the value of the GCM, but not only implementing not only having programs implementing activities to support the objectives of the GCM, but also aligning with its principles. The GCM is a very principled document. It has 10 guiding principles, such as, well, gender responsiveness or the whole of society approach, different aspects that need to be really highlighted in the way we work around migration. And everything the fund is doing is trying to showcase how, by these principled programs or this principled approach, this strong alignment with these guiding principles can be useful and can have an impact on the life and situation of migrants and host communities. Now it's supporting, and the idea of the fund is not to be a multi-billion-dollar fund. It's supporting ideas, it's supporting pilot initiatives in a way. It's trying to demonstrate the value of new approaches that can be scaled up and replicated. Its original name contained in the Global Compact on Migration resolution was Startup Fund for Safe, Orderly, and Regular Migration. So that's the idea of this. Now comes the question of the priorities. It's a bit of a tricky one because I will go on the priorities and I will explain. But first, the key word of the fund is, and the word that has probably been heard most in its steering committee deliberations, is balance. Balance, because the Global Compact on Migration is in itself a balanced document. It has listed 23 objectives, which have been clustered now under 5 thematic areas, but it has, and these 23 objectives, none is more important than the other, and it's very important to the spirit of the Global Compact on Migration. And the fund needs to also respect and work with that spirit. So the fund has to be balanced in the way it distributes its funding between the different objectives that have been set, that can, some of them being seen more important by some stakeholders than by others, but overall that approach needs to be balanced. It needs also to be balanced geographically. I mean, migration is a phenomenon affecting all parts of the world with its own challenges and opportunities everywhere. So the fund has to be supportive of all regions and sub-regions. So on that background and backdrop of balance, yes, there are some priorities. Actually, there are 3 thematic priorities that have been identified explicitly by the steering committee. The first 2 may not be the most interesting to you, but I will still mention them. They are climate change, and this is understandable in the world we live in. There is a need to look into the issues of the impact of climate change on human mobility and trying to address it. The second one is on preventing the loss of lives in transit. It's objective 8 of the Global Compact of Migration, which is saving life and establishing coordinating international efforts on missing migrants. It is clear and it is acknowledged by member states themselves that this is an objective that is clearly lagging behind in terms of efforts that have been made. The fund is also supposed to try to help this. But the third one is probably the most interesting today. It's health. It's improving access to essential healthcare services by migrants that has been identified. It's been identified, of course, it's a side effect in a way of the pandemic, but it goes way beyond this. the pandemic has exposed weaknesses and issues that were there before the pandemic and will remain after the pandemic. But it has brought the spotlight on it, and that spotlight has helped identifying this issue as being one of the priorities when we talk about implementing the Global Compact on Migration. So we have examples of such projects. They are happening. There's we could maybe, I just don't want to, I'm conscious of time, so I won't elaborate much. But I just want to say there is some is happening, but more needs to be done. And WHO, who was a member of the steering committee for a few years since its inception, has been a strong advocate for this, and it is now officially a priority. And we are looking for more ideas, more projects coming with an health angle. It doesn't need to be health as the only objective. It's health integrated in an overall approach, with a strong health component in it. I'll leave it there. I'm conscious of time. Sorry for having gone a bit beyond.
No, that's absolutely fine, Philippe. Thank you so much for this really interesting and unique mechanism at global level for financing different efforts developed over the world. Dear Santino, would you like to share with us a brief comment on Philippe's intervention? No more than 1 to 2 minutes, if you may. Thank you.
Try to be telegraphic on 3 points. Indeed, personally and as a WHO, the experience in collaboration with the network and the fund specifically is extremely important. The objective 15 of the GCM, and I'm encouraging all the audience to go to look for that, clearly refer to WHO Global Action Plan. So there is a very powerful alignment and synergy. So we have a direct stake in the success of the GCM, because this means strengthening the sensitiveness capacity and efficiency of the health sectors in relation to migration. The fund played a very important enabling role for us, for the health sector, for WHO. By nature, migration is a multi-thematic, intersectorial, all-government business, very challenging, often at the country level. But when the intersectoriality was translated into the UN network and the fund, actually, and I'm not anymore so young into the system, I noted one of the most successful network establishment where there is clarity on mandate, there is clarity on utilization of the comparative advantage of each UN agency which is involved into the network. And this is, by cascade, is reflected also the interaction and collaboration with the fund. The fund playing a similar and important enabling role with the countries. Not necessarily health is, or the health dimension of migration is a priority at the country level. They might have still need to face basic health issues. So how this is going to be promoted? Well, it doesn't become anymore WHO business only, or a UN business, but becoming UN country team. So the entire team present in the country will tend to pursue the most important priorities, also factoring in element of migration, data, information existing in the country. Last but not least, I'm linking to what Philippe was saying. The fund has an agile and flexible mechanism to reorient priorities. Our experience, particularly during COVID, was that health was immediately recognized to be not just as advocacy element, an important issue, but really an area of engagement. Vaccines, access to vaccines, how to prepare for the next pandemic. So the fund can play, and the UN network, as a consequence, a very important amplifying role in terms of addressing priorities which are burning for the health sector at that moment. Thank you.
Thank you very much, Santino, and thank you, Philippe. As you both said, it is essential to recognize common priorities and shared needs across regions in order to achieve a true global perspective on human capacity building for the health of migrants and refugees. In a way, it is only through a joint vision of these priorities and themes that countries and regions can catalyze effective international cooperation. Based on everything we have discussed so far, it comes to our attention that one critical aspect to reach effective healthcare provision for migrants and refugees is continuity of care. This raises the question of how can continuity of care be implemented across countries. I will now invite Dana McLaughlin to kindly join us and share with us her thoughts around this question. Dana is a public health professional working in Washington, D.C. as a senior global health policy associate at the United Nations Foundation. In her current role, Dana leads the Foundation's cross-cutting portfolio on health and last-mile populations. Her work and research focus on adapting global health policies, resources, and programs to ensure they address the needs of displaced and marginalized populations, particularly in the areas of HIV, TB, and malaria. Dear Dana, please, the screen is all yours.
Thank you so much for the question, and thank you to the organizers for the invitation. I'm honored to join such an esteemed group of experts on the panel. So leaving no one behind is the central transformative promise of the 2030 Agenda for Sustainable Development and the Sustainable Development Goals. This commitment is our shared responsibility, especially when it comes to protecting the health rights of migrant, displaced, and refugee populations. Preserving the continuity of health services across countries and borders and regions is a tremendous and complex challenge. But I'd like to also think of it as a unique opportunity for national, civil society, and humanitarian partners to come together in novel ways to maintain the continuum of health services for migrant populations and to protect their human right to health. We've seen this continuum of healthcare implemented in so many challenging operating environments with different compositions of migrant populations. One example that I'd offer is the creation of a cross-border surveillance system that makes qualified data instantaneously available to all parties involved in malaria control between French Guiana and Brazil to support malaria case management for Venezuelan migrants in the border region. Another great example is the collaborative efforts between governmental and non-governmental agencies along the Vietnam-Cambodia border, where over the past 2 years, they've been working in unison to better understand the barriers and enabling factors that support access and utilization of TB diagnostic treatment services among cross-border migrants in order to strengthen the continuum of TB treatment and case management. I think TB is such a compelling example of why cross-border initiatives must be a central part of any country's national strategy. It is estimated that millions of TB cases are missed every year by the health systems, with vulnerable populations, particularly migrants, internally displaced persons, refugees, and other marginalized groups, most at risk of contracting the disease. Lack of access to health insurance, increased stigma, language barriers, unrecognized legal status too often prevent migrants from accessing the critical diagnosis and treatment of TB and other life-threatening infections. These factors are compounded by the mobile nature of migrant populations who, even when they're tested for TB, too often move to another location before the results are available. As individuals with chronic conditions move from one place to another, they tend to experience episodic rather than continuous care. And this has serious consequences for the clinical management of conditions like TB, hypertension, diabetes, HIV/AIDS, and it makes it more challenging for medical professionals, humanitarians, and other care providers as well. It is difficult to improve the continuity of care in cross-border settings unless we address the legal, financial, and social barriers that too often prevent or discourage early diagnosis for completion of treatment. This is one area where policymakers, national governments, and donors can continue to support the development of new TB tools and treatments that are better suited for people on the move. Any cross-border health program must place the individual at the center and prioritize and consider all the factors that inhibit them from accessing consistent care. I think we can always do more to listen to migrants themselves in settings where we work and ensure that the systems that we are designing and the funding that we are providing are actually responding to the everyday challenges, needs, and concerns that individuals face when they're seeking healthcare services as they migrate. By prioritizing resources and funds for multi-country and cross-border TB, malaria, and HIV programs, not only are countries able to reach more people with life-saving services, but they're also building better capacitated, people-centered, and disease-agnostic health infrastructure that will support the realization of universal health coverage for all. These investments also directly contribute to the health and the resiliency of the community, the country, and the region for both migrants and host populations alike. Like so many other things in public health, cross-border systems that protect the continuum of access to health services rely on having the requisite evidence to effectively inform and instruct policy and decision makers. We are all too familiar with the funding gaps that inhibit today's humanitarian situations and so many of today's complex crises, climate-induced emergencies, and disasters. This is where we must continue to work with national governments, multilateral partners, bilateral donor governments, the private sector, development banks, and so many others to advocate for increased funding for health programs that are both cross-border regional approaches and then invest in routine migrant-centered health services from one side of the border to the other. I argue that we could all do a little bit more to uplift some examples and well-evidenced success stories of cross-border health programs, such as those two that I referenced at the beginning, so that we can build on these strong examples, adapt them when necessary, and most importantly, use them to demonstrate the high return on investment and reduction of morbidity that comprehensive cross-border health initiatives can deliver. Moving forward, this is an area that demands greater collaboration across national humanitarian and development partners so that together we can continue to make the case for greater investment and prioritization of cross-border migrant-centered health programs. I know I'm almost out of time, so I'll wrap things up. I just want to leave you all with a couple more thoughts. First, I do believe that the time is now to generate greater imperative for countries and donors alike to more squarely address and close the policy, finance, and programmatic gaps that ensure migrant, marginalized, and last mile populations are truly not left behind. And in conclusion, I think a person's mobility must be integrated at the fundamental design and delivery of health services through cross-border and regional referral systems. And aid agencies can successfully work with stakeholders from health and non-health sectors to protect the dignity and health of each and every migrant, whether they're 10 miles or 10,000 miles from their homes.
Thank you very much, Dana. Thank you very much. And I would now kindly invite you to briefly comment or add anything related to Dana's intervention. Keeping in mind that we're running a bit out of time, if you would like to share one key message, for example, that would be great. Thank you, Anne. The screen is yours.
Yes, thank you very much. And thank you very much to Dana for that really comprehensive coverage. I think just a few things I think based on our experience with the refugees, I think some of the most important things is to early identify in a way that respects privacy and confidentiality of refugees and migrants, those that are in need of ongoing treatment. And now, of course, we're not only talking about HIV and TB, but other chronic diseases, including diabetes and hypertension. I think establishing referral pathways, but also planning for increased drug needs in preparedness plans. And for example, with the Global Fund, we have mechanisms now that allow for resources to be mobilized, to be able to quickly support countries. With Gavi, we also have this for immunization, but what about diabetes? What about hypertension? What about people that are on cardiac medication? And then lastly, one other point would be just the need to support ongoing treatment. So not only linking people to treatment, but also linking support for adherence to that treatment, using digital tools, using same language service providers and same language information materials. And then just one other thing is actually harmonizing treatment protocols. And I think we saw this with the Ukraine refugee situation, is that different countries had different treatment protocols. So there was a lot of work that needed to be done to actually harmonize those throughout the region. Thank you very, very much.
Thank you, Anne. Truly, really, really interesting points to add to Dana's discussion and intervention. I will now ask Philippe to come back to the screen. I know you're there, Philippe. Thank you so much. Philippe, improving competences of staff dealing with migrant populations is crucial to ensure the correct implementation of what you have already shared with us related to MPTF's funded projects. On this regard, how MPTF is promoting those competencies? Are training activities included in your portfolio? Also, if I may, what could be possible, the possible role of MPTF in strengthening international coordination and collaboration for enhancing competencies of health staff dealing with migration issues? Please do go ahead. Keep in mind that it's a top to 2 minutes intervention, please. Thank you so much.
Thank you, Baltika. I'll keep that in mind. Just to say, of course, training activities are included in what we're doing. They are a big part of what is being done. The fund is, as we said, it's called for by the Global Compact on Migration, but it's not it's not a floating article there. It is part of what the Global Compact on Migration calls the capacity building mechanism. It's one of the components of the capacity building mechanism. So there's nothing more natural for the fund than to do capacity building. We don't fund programs that are specifically just in training, but training activities are very important as part of all the programs we implement. And there is a number of examples of training activities for health personnel or for frontline workers on migration issues to include some health competencies and dealing properly with it. A lot often doing around trafficking issues and gender-based violence, but also prevention of rapid detection of epidemics. There's a number of activities like this. Now, very quickly as well, the second part of the question on international cooperation, because of the nature of migration and migration issues, we do have a large proportion of projects that are not single country projects. We encourage a lot country collaboration. We have, whether it's sub-regional, we have projects in the Pacific region, a project in the IGAD region with the region, or one-on-one cooperation of countries sharing a border, like Guinea, Liberia, and Sierra Leone, actually, or not sharing a border in South-South cooperation. I have a good example of that between Chile and Mexico, the cities, which also actually includes strengthening of health services in the two cities. So yes, we try to do a lot, and I will have to stop there because I'm already at the 2 minutes.
Thank you very much, Philippe. As you all have said so far, it is human capacity building the bridge towards governments and nations that understand how deeply connected we all are and the significance of protecting the health needs and rights for all, including the specific needs and rights of migrants and refugees. In this regard, it is useful to learn from the experience of international organizations that work in this field. That is, to pose the question, what are the current and upcoming opportunities to promote capacity building for the health of refugees and migrants to key stakeholders? To reflect upon this question, I asked Poonam Dhawan to come to the screen. Thank you so much, Poonam, for being with us today. Poonam serves as the Global Senior Migration Health Policy Advisor for the International Organization for Migration, IOM, and is based in IOM, Washington, D.C. In this role, she's the responsible for advice and guidance on migration health policies development and implementation. Dear Poonam, please, the screen is all yours.
Thank you, Baltika. And may I just check in terms of the Zoom connection? It's all right to go
Yes.
a few minutes over the hour. And yeah, thank you. So very happy to be able to speak with all the participants at the school. I understand it's the last day today. And also I'm your last speaker in this session. So already a very rich discussion. And what I'll try to do is be brief, but perhaps share later a document with some of the resources that indeed would be my answer to your question on the opportunities for building capacity of systems and stakeholders for the health of refugees and migrants. So in a few minutes now, I'll just try and share some perspectives and examples, hopefully to increase a bit the knowledge of the attendees in terms of these opportunities, primarily coming in, of course, from the perspective of IOM, but important to note that most of this work and outreach is being done in cooperation with governments, with WHO and other UN partners, including the Network on Migration, as Philippe referred also to the MPTF. So I think the gist of all the interventions so far, we know already tells us that what is needed is a whole of society and a whole of government approach. Solutions do not stay within the health sector alone, and we have to really look at this more broadly. So 3 key opportunities that are both current and have future prospects. One is looking at the existing frameworks and how to operationalize them is a key opportunity in terms of building capacities. So whether it's the GCR, whether it's the GCM, and also very importantly, the 2030 agenda. So not only SDG 3 on health, but how health and migration cut across all the SDGs, including number 10 on inequities. So for instance, in fact, working with partners in the through the UN Network on Migration, there is now a capacity building tool that can indeed work with UNCTs. Santino referred to the UN country systems as to how different UN entities at country level can then work with governments in order to integrate migration-related work within their own country cooperation analysis and frameworks, which governments are engaged closely with UN partners on. On the other hand, there is also now a multi-sectoral package on mainstreaming migration into cooperation and development frameworks. So really, again, tools and guidance, including one on health that WHO also contributed to, that can be used not only for governmental, but also non-governmental stakeholders on how migration can be integrated in the SDGs agenda. And finally, also now live, in fact, IOM just discussed it yesterday with member states at our council, is a tool on essentials of migration management that really takes it to the day-to-day work in governments and other stakeholders at country level on how to integrate migration. Now, the second angle I would say is in terms of capacity building, both in the health sector as well as other sectors. And just a couple of examples coming out of the pandemic, of course, very important to look at capacity development for risk communication and community engagement to really bring operational action to the local level. And those tools and capacity building materials also now exist, and the challenges, and hopefully some of the participants of this school can actually bring some of those tools forward in their own work. Similarly, of course, and Philippe also mentioned this need to identify epidemics and health outbreaks, and how can we really engage with non-health sectors at points of entry, whether land, air, or sea, as well as looking at the border and mobility management and how to integrate health-related trainings and capacities within that. And lastly, a very important example, of course, is the work with ILO, or looking also at human resources for health, which was a topic of the school here as well, and making sure that those frameworks and tools for enabling rights of migrant workers, or looking at ethical recruitment of health workers, are truly incorporated into systems that are going to work on migration issues. So Baltika, in the interest of time, I'm happy to stop here and wait for your cue also for some overall reflections.
Thank you very much, Poonam. Dear Dana, based on your particular experience, would you like to share something or comment on any point shared with us by Poonam? Please keep in mind no more than 2 minutes, please. Thank you.
Yes, I couldn't agree with so much of what Poonam just shared with us today, especially surrounding her comments on community engagement. And we saw that play out so effectively in the rollout of COVID vaccines, for example. One thing that I'd like to add just briefly is, at a time where we see renewed energy and political will at the global, regional, and national level to support investments in pandemic preparedness, prevention, and response, I think it's critical that we do our part to make sure that these investments seek to strengthen and opportunities to strengthen global health security do not overlook the growing needs of populations on the margins of our health systems and societies, especially migrants, refugees, or victims of climate-induced disasters or conflict. I think we need to demonstrate how investments in the continuum of health services for migrants actually strengthen and are the first mile of investments in global health security. I know that was also mentioned by Santino earlier about, the global attention on pandemic preparedness and response. And I think we can all do more to make sure that migrant populations are at the center of those conversations as they continue to evolve. That's all. Thank you.
Thank you so much. Thank you so much, Dana. Dear Poonam, to wrap up our discussion panel today, we're reaching the final moment of our discussion panel. I would like to ask you to briefly comment on which are, in your opinion, the main key steps to follow for every region to effectively promote this and strengthen international cooperation and synergy, and the role of human capacity building in this process. Please, just 1 to 2 minutes comment. The screen is all yours.
Thank you. Did we want to look at any questions in the chat, Baltika, or will there not be time for that? Because perhaps the Secretariat can share some of the comments and questions with the panelists if these can be communicated later.
Thank you, Poonam. You could share your 1 to 2 minutes comment now, and then the coordinating team will take on the session. Thank you.
Sure. Okay. No, so just to wrap up, and Baltika, you've done a good summary already for the various topics covered by our panelists, whether it's the main issue of cooperating in terms of promoting refugee integration within national health systems and not creating parallel systems, as mentioned by UNHCR. The discussion on, looking at the comprehensive priorities in the WHO Global Action Plan for Health of Migrants and Refugees and how to operationalize that mentioned by Santino. I particularly liked the framing of the migration MPTF in of itself as a cooperation tool, and that really should in fact also be a core principle of various other funding and resource mobilization mechanisms. The power of the process, like bringing different stakeholders together to strengthen international synergies. Overall, of course, in the spirit of the title of this session around international cooperation as well as capacity building as a theme for the school. So indeed, there are existing frameworks, and the gap is now in order to mobilize the guidance and tools to build capacities at all levels. And I cannot reiterate enough the need for the health sector to do this together with other sectors working on migration, as well as looking at cross-border and international cooperation, because simply by virtue of the subject, we cannot find solutions at national level alone when we are speaking of migration. So I'll leave it at that, and thanks again to the organizers.
Thank you so much, Poonam. This is the end of today's panel discussion. I would like to thank all panelists for their wonderful, generous, and well-informed interventions. Thank you so much for your attention, and I will now pass the floor to Giuseppe Annunziata for some final remarks and comments. Thank you very much.
Thank you, Baltica. Just telegraphically, a reaction from my side after having followed this interesting panel discussion. It is really amazing on the quantity of capacity build and the quality of capacity building activities that are at the moment implemented globally, funded by international organization and implemented also and promoted by the international organization. There are also quite a number of training activities, formal and informal, that are conducted by the civil society at country level. I would just to emphasize how important are also those building on existing capacity activities. And I'm wondering if there is any effort to further promote and coordinate all this ocean of activities that are ongoing, often done by voluntary organization. Probably starting mapping them could give us an idea on the enormous effort that are ongoing. Thanks. Baltica, back to you.
Thank you very much, Giuseppe. And I will now formally finish this panel discussion. I will ask the coordination team to take on from now. Thank you so much to the organizing team for trusting me, and thank you, dear panelists. It has been a true pleasure. Goodbye.
Thank you very much, Baltica and other members of the panel, for availing us of your expertise and your time. The discussions were very educative, insightful, and they go a long way in enriching our experience and developing capacity for cooperation and synergy for migrants and refugees. So thank you once again. So we'll move on, and I will be handing over the reign of affairs to the Director, WHO Program on Health and Migration in HQ, Geneva, Dr. Satino Severano. He will walk us through the remaining part of the program and also provide his final remarks. Dr. Severano.
Thank you, Anthony. Thank you again. Once more, I will never stop to thanks, actually, because this was another very intense week, and we are just overwhelmed by the participation, by the feedback, by the appreciation of this type of exercise. This is a very important for us because it's an encouragement also for the next schools. Its encouragement is a support to do better and better in the next year school or schools in the year to come. We try to really open a window on the issue of competencies for healthcare worker, linking. Unfortunately, we couldn't touch all aspects of competencies. This is obviously due to limitation of time, and we could not have more than this as a time available to touch upon, but I believe that this has been stimulating a lot of discussions, a lot of interest, at least looking at the feedback from the audience. And we've been trying to address the most strategic elements related to the most important issues of competencies. The example of today, it's a very, very complex issues, the multilaterality, the regional cooperation, but also the debate around the health system, without mentioning the sensitiveness of addressing right to health or human rights and gender, addressing the behavioral elements, the cultural elements related to our work, or to the health issues related to population movement. So the week was also possible thanks to a fantastic collaboration from all WHO regions and a number of partners who developed ad hoc video for the school. Those are original productions that we're going to make available on the web page of the school, so that can be downloaded and further watched. Although all these videos are already also on YouTube. We will post on our webpage all the presentations done by the high-level speakers and done by the expert. Some of them they are really precious pieces of academic lectures. So really useful for continuing to deep dive into those topics. We are aware that we are owning quite a few questions to address. This is a point of principle. We were going to address them offline and follow up on all of them. I thank you, and I'm asking you the last effort of the week. Please send us the evaluation for the day 5 for today. We had a very intense feedback reporting from all of you, and very interesting insight, very interesting suggestions. Then countries. I want to start by thanking Bangladesh, but also other countries that have been following the entire school. We talk about an average of 130 countries on daily basis. So people, representative from about 130 countries on daily basis. Even today, that is Friday, so which is holiday for many, many people around the world. So deep appreciation for those who came here in person on Friday or following at home instead to be with their family our session. This is really highly appreciated, and again another element of encouragement and motivation to do more and more and more for countries and for this group of people. We are already into the pre-planning stage for the next year school. I'm not going to disclose where, because we have 2 regions which they put forward the interest. So we are completing the discussions with the region. So forgive me if I'm not going to share today where we're going to meet next year, but I can tell you in both cases, any of the 2 that will be, let's say, the winner are extremely interesting reality, extremely different set of experiences. So please stay with us and let's stay in touch with us. During this week came very strong out, particularly looking to the good example of EMRO, AFRO, that we should probably get together with partners to make sure that regional courses also started. It is very important, the relationship with the academic institution, the day on research, and the discussion around the academic institution is not just very important, but we consider them part of the team. So it's very important to strategize how to support regions to start to come up with courses tailored to the specificity of the region. You remember my playing with words glocal. So really looking at how to download the global principle and into a local context. I'm stopping here. I don't want to take more of your of the remaining part of your Friday, but I want to take the opportunity, and I'm sure you will appreciate, to launch the video message of our Director General that is really a big supporter of the school. Every year is with us, and this year we wanted to put the addressing of our Director General at the end as a goodbye, or au revoir, or arrivederci, see you next year. Please, if we can launch the video.
As we speak, 1 billion people are on the move, some voluntarily, some forcibly. Migration and displacement can have deep and long-lasting impacts on physical and mental health and well-being. To make matters worse, cultural and linguistic differences, financial barriers, stigma, and discrimination can all hamper access to health services for refugees and migrants. Health workers have a crucial role in helping to overcome these barriers. The first WHO World Report on the health of refugees and migrants shows that around the world, countries are making progress to strengthen the competence of their health workforce to meet the needs and rights of refugees and migrants. But there are still many gaps. As you have learned this week, building inclusive, culturally sensitive health systems requires investments in capacity building and training for health workers. It requires interpreters and cultural mediators to support them. And it requires including refugees and migrants in the health workforce. We hope that this third WHO Global School on Refugee and Migrant Health has been a valuable resource for building the capacity of health workers to better serve refugees and migrants and build a healthier, safer, fairer world. Thank you for joining us, and see you next year.
Thank you, Dr. Tedros, for his continuous support to this topic. And now there is a little ritual at the end of every school. I like to take 1 minute, 2 maybe, of your time to thank all those which work around the school. Without this group of people, we were not going to be here, and the school was not going to be possible. And I asked my colleagues to give me the list of names, because I like to really go back one by one. But I got between school speakers and all of them work behind the stage, on the backstage. I'm having 47 people, so I'm going to skip the list. Will be rather long reading, but certainly I want to start with Bangladesh Ministry of Health for the way out they welcome us. We were, since the very first moment, received with big interest, and we hope that we rendered a good service to the cause, to the work on health of refugees and migrants, by offering a global stage to debate and to discuss key issues related to the public health aspect of population movement. And then after the local authority, I cannot, my mind can go only to colleagues in Cox's Bazar. First of all, for the work they do on daily basis. They are frontline colleagues. And today, this week, you've been hearing some of the testimony of their own experience, capacity, and practices, but also the country office here. Again, they were the first one jumping positively on the idea, and we're really happy of also the close collaboration of these days And I hope this is going to be just the beginning of more activities, and we are looking forward to continue to be very close to Bangladesh. Perhaps I really would like to explore if Bangladesh can express one academic institution to join the global network and to be with us, for example. Country office, not only together with the team in Cox's Bazar, welcome us, but also they share the burden of preparing the school. They really carry on their shoulder their work. So really, thank you personally. And from the DDG, in behalf also of DDG, that is leading this area of work at the headquarters. The regional office, I see Arti and Edwin is waiting for me in Geneva, where we have another important meeting already starting on Monday. Regional office was really the engine behind, because was regional office saying, no, Seattle this year, and Bangladesh was the first proposal. So we were not left with other choices that to make it big and to make it nice for Seattle, looking into Bangladesh reality. Thank you so much, Arti and Edwin, for your collaboration and friendship. Then I'm going to the all academic institutions. Today you have seen Baltica, but also every day there was an academic institution which has been working with us in different stages, not only during the school. Those are our key partners. Thank you very much for the support. Thank you very much also to the partners. You've seen IOM, UNHCR in different contributions. Those are regular, very close, hand-in-hand partner for our work. And last but not least, besides to thank my friend Anthony that today shared the last day burden, usually the tail is the most hard to skin. And I want to thank my team. Allow me to pass all the credit, all the thanking and all the appreciation to my team that is driving now on a yearly basis the preparation of the school and the implementation, and never tired to face difficulties, challenges, never losing control, and despite the pressure, always standing there ready and committed to act. So thank you very much. A little surprise. Can we launch it?
Strengthening the capacities of health systems to respond to the health needs of refugee and migrant populations is vital.
The school is also for everybody, policymakers, specialists, academics, students, NGOs, international organizations. They're all welcome participants.
Can we get migration into existing interventions? And then this will be a win for everyone who is reliant on those healthcare services.
Is a key role for WHO as well to act as a convener and to be able to help to facilitate that collaboration and dialogue between policy, research and practice.
Thank you. See you next year.